Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. I'm your host physiotherapist Meghna Dave, and in today's video, after a very long time, I'm going to talk about facial paralysis. So, what you can expect in today's video? I'm going to rewind every detail, every information that you should know about Bell's palsy, which I have already shared in my previous video. I'm going to merge everything into this one video. So if you who are someone who wants to understand about facial paralysis or Bell's palsy, this is a kind of an highlight or summary video which will kind of give you an understanding about Bell's palsy altogether. So if you want to know this, make sure to watch this video till the end. Let's begin. But before beginning, also make sure to subscribe to HealthQ channel so that you can get notified every single time we upload a new video. We create videos on your physical well-being because our mission is to make sure that you can move better in your life. So let's begin. So friends, as I said, facial paralysis, which is a condition altogether, has one very unique condition in it, which is called as Bell's palsy. Right? Many people think that Bell's palsy and facial paralysis are the same, but it's not true. Bell's palsy is a condition in which the face gets paralyzed, but there are many other causes due to which the face can get paralyzed, right? So when we say facial paralysis, it means the paralysis of a face, right? That could happen due to a stroke, due to a condition called as Ramsay Hunt syndrome. It can happen in condition called as Guillain-Barré syndrome, as well as it can happen due to injury on your facial nerve following a tumor, or is following an accident, or is even after a surgery, right? And one more condition that causes facial paralysis is Bell's palsy. Okay, so Bell's palsy is a different condition. Usually this is idiopathic, which means that there is no actual known cause for it, but most of the time Bell's palsy happens when there is an inflammation that happens on the nerve following a viral attack. Okay, so let's first understand the cause behind Bell's palsy. Okay, or else facial paralysis. As I said that there are many causes, we'll emphasize more on Bell's palsy. So if you who are someone who have developed an ear infection, if you are someone who had got a drop in immune system, if you are someone who was exposed in a very extreme temperatures at the same time, or else if you who are someone who was attacked by a virus, in all these situations you are likely to get Bell's palsy. Okay, now Bell's palsy, as I said, as such does not have an unknown cause but have many triggers to it. What we have observed in our period of practice is stress, physical exertion, emotional exertion, okay, and even mental exertion can lead to drop in immunity and can lead to Bell's palsy. Again, if an individual have gone through an immunity drop following an injury or as an illness, at that time also an individual can develop Bell's palsy. Third is pregnancy. So during pregnancy, the fluid retention is very high, and due to that fluid retention also a woman can experience facial paralysis or Bell's palsy. Okay, so these are the typical causes of Bell's palsy. Now, what happens during this Bell's palsy? Your one side of the face gets completely paralyzed. Okay, this side or this side, whatever side it is, gets completely paralyzed, and mostly the nerve on the same side is affected. Whereas in stroke based facial paralysis, it's opposite. So the opposite side of the face will get paralyzed to the injury. Okay, so that's a very major differentiator. Now, when your face gets paralyzed, what will happen? Suddenly, when you wake up in the morning, you will observe that you are not able to smile well, you are not able to hold water in your mouth, you are not able to close the eyes properly, you are not able to do the facial movements properly, right? And the severity of these symptoms will vary individual to individual depending on the severity of the Bell's palsy or is the severity of the damage that has happened to the nerve. Now, whenever you develop this Bell's palsy, it is very important for you to go to a doctor and take medications on time, because there are many people who think that this will automatically resolve, even though the natural healing process do happen, but it's important to take your medication in for 72 hours, because when you take your medication for 72 hours, the swelling and the inflammation that is formed there starts reducing and the nerve gets a chance to recover. Okay, so that's what happens. Now, talking about the things that you should do, the most important part of the video, right? So basically in Bell's palsy, we consider a patient to go through three stages. Number one stage is called acute stage, number two stage is called subacute stage, and number three is called chronic stage. Majority of the time, I would say 95% of the time, patient gets out of Bell's palsy just by taking your normal medication and taking your regular rest and care in subacute phase only. They don't fall into the chronic phase. Okay, but people who have got very major viral attack or very major damage to the nerve, very major infection, very major inflammation, they are the ones who will also go through the chronic phase. Okay, so what are these acute, subacute and chronic phase? Let me explain. So acute stage is where your face is completely paralyzed, there are no movements that are present, your face is absolutely flat. Okay, this time usually varies individual to individual, but the first 3 months or 90 days is the timeline where your nerve can go through this phase. Okay, now again, as depending on the level of inflammation that was there on the nerve, the level of damage that was happening on the nerve, your recovery would be determined. Okay, so for few, if it is very mild, an individual can see recovery in 1 week. For few, it can take 15 days. For few, it can take 1 month. For few, it can take more than that. So this is something that is variable, and that's why acute phase is considered till the time your face has no movements at all. Okay. After the acute phase is over, comes your subacute phase where your face starts showing some mild movements. Okay, so this is the improvement phase. You will be happy, you will start seeing some movements coming back on the face, and it feels good that okay, now my face is recovering, now everything is coming back, right? And this time your movements are even though present but are weaker compared to the normal side. So you're not absolutely recovered 100%, but your face on one side seems little weaker, but the movements are present. So that's a good news. And slowly, as you recover, as the healing happens, your face absolutely becomes fine. And this happens 95% of time. For 5% of people where the damage was more, they will show longer time for first to show movements on the face. After the movements have recovered, these movements will be very less, very mild, very few. And these people eventually in future might develop synkinesis. So synkinesis is one such complication where there are extra movements that are present on the face. Along with that, they will also have some facial muscle tightness. Some can also develop some contractures and other issues also can come. So there are these three phases of facial paralysis or Bell's palsy. Okay, now how to manage is also something that is different in each of these stages. But before I talk about how to manage, it is important to talk about what is the goal of management, because this is something that needs to be understood by every patient. Every patient, when they come, they want to just get better and get fine with this as soon as possible. Unfortunately, it doesn't work that way. The nerve is going to take its own time of healing, of recovering. Okay, and we have to give the nerve that time. Meanwhile, what we need to do at this time is to enhance the recovery process, to aid the recovery process, and that's the goal of treatment. The first part was the medical management, right? When you are supposed to take some medicines, you have done that job, right? But there are other jobs as well that you need to take care of. So let's talk first about the acute stage. So in acute stage, the idea is to prevent the secondary complications like eye infections, facial muscle contracture and facial pains, because all these three are very common. Your eyes is not closing. Now as the eye doesn't close, a lot of dust particles will go in eyes and it will irritate your eyes and you might develop eye infection. So that's number one. Number two would be your facial facial muscles would be pulled downward, right? And that pull can cause facial pains, facial tightness, right? So that also needs to be avoided. And third would be the movement side, so you will not be able to move, so that needs to be prevented. Synkinesis needs to be prevented, extra contractions needs to be prevented. That is the goal of the treatment in acute phase. Coming to the subacute phase, where your movements have started showing recovery. So you are in that recovery process, you feel happy about it. But at this time, patients overestimate themselves and they start doing very hyper aggressive or hyperfacial movements. This is something that needs to be avoided in this stage of Bell's palsy. So in subacute stage of Bell's palsy, enhancing the recovery process, training the facial muscles to move in the right pattern, the older patterns, is more important than forcing the facial muscles to move. Okay, that's the goal in subacute phase. And then comes the chronic phase. Now in chronic phase, the idea is to facilitate natural movements as much as possible, limit or try to minimize cell kinesis as much as possible, also to maintain good muscular flexibility. Because it's a chronic condition, the muscles have to go through a lot of wear and tear by this time, so muscles become tense, taut, shortened, and that leads to facial stiffness and tightness. Patient usually experiences this facial stiffness and tightness around the eyes and around the jaw region. This needs to be prevented. Okay, so these are the three major goals that we have when an individual is suffering from Bell's palsy. Now, what should be the treatment? So the treatment also varies in these three aspects. Number one aspect is your acute phase, right? So as I said, in acute phase, chronic phase, or subacute phase, in all of these we give three-step process to patients. This three-step process varies or differentiates, but mostly it comprises of hot fermentation, massages, and neuromuscular re-education techniques, right? Now, in the early phase of Bell's palsy, the idea is to prevent eye infection, and that's why there's a lot of emphasis that is given on eyes. So eye taping is advised, eye patching is advised, repeated eye stretching is advised, so that your eye muscles don't go into contraction. Along with that, the face is likely to develop pain because the muscles are gradually being pulled by gravity, and that's why hot fermentation is usually advised. And facial massages is advised in the upward and outward direction to enhance your lymphatic drainage, to improve the blood circulation, to retain the position of these muscles along with the fat pads, so the face stays as neutrally placed as possible. Sometimes face prosthesis or face belts are also advised if there is a lot of droop present on the face. That's the perspective of treatment in the early phase of Bell's palsy. Coming to the subacute phase of Bell's palsy, the focus is on enhancing the movements that we have already developed, right? So in previous phase, where we suggest more of passive exercises, where the exercises needs to be done only with the support of the hand, in the subacute phase, you start giving some work to these facial muscles and some load you still carry with the hand, right? That's why we do something called as active assisted exercises. So active assisted exercises are nothing but the exercises done with partial effort by yourself and partial effort by your hands. Along with this active assisted exercise, definitely the eye care needs to be continued, facial massages needs to be continued, facial stretches needs to be continued if it is there. Right? Now, facial stretching is something that doesn't necessarily need to be done on the affected side, but mostly is advised on the non-affected side, because that is overworking and that can cause damage, right? And that's why subacute phase is more about training the muscles. So one thing that's very important to keep in mind while doing passive exercise or subacute exercise is to keep the expression in the mind. See, what happens is, before Bell's palsy, we don't think of facial expression. It just comes automatically, right? We don't think of raising eyebrows. We don't think of closing eyes. We don't think of smiling. It just comes naturally. Suddenly, when Bell's palsy happens, what do? Your entire focus is falling on the face, and you're trying to ask the brain to send all the signals to get moved. Now, brain is intact. Nothing has happened to the brain, right? So brain starts releasing more and more neurotransmitters that gets blocked at the ear level. This leads to inefficient movements in future, right? This needs to be avoided, and in order to do that, we have to utilize our limbic system, the natural emotional center of the body, utilize the natural expression combined with support of hand, and then achieve the natural movement pattern. So that is something that needs to be achieved in the subacute phase. And then comes your chronic phase. So in chronic phase, the idea is to work on synkinesis. Now again, synkinesis is or synkinesis treatment is altogether a different thing. The idea is to reduce synkinesis, retrain the facial muscles and relax the facial muscles as much as possible. So whenever an individual comes to us with synkinesis, what we need to do is we need to identify what is the timeline at which the patient has come. Second, how severe is synkinesis? And also to identify, is the synkinesis the real cause or is the facial muscle tightness? Because sometimes patients do so much of over exercising that face muscles become so tight that it's not the synkinesis but the tightness that's causing all the problem. So we need to identify and need to work accordingly. So in the synkinetic stage, what we need to do is synkinesis control exercise, where we try to minimize synkinesis as much as possible, ignoring that area and focusing on the right muscles and encouraging right movements to happen there. That needs to be done again and again till the point that the movement starts getting better. But here's the catch. Many times what happens, patients suffering from synkinesis learn to control synkinesis voluntarily, but the moment then they do natural expression, synkinesis starts coming again. This happens why? Because we are not doing the neuromuscular re-education part or the mental imagery practice. Now, our brain has some memories of our face. We need to utilize that. And that's why we give imagination exercises. In this imagination exercise, basically you try to recall your facial expression and try to mimic without physically moving it in imagination these facial muscles. This is called graded motor imagery techniques, right? Then you also try to visualize your facial muscles being moving in the right manner and right intensity. The beauty is you are not physically moving it, but in imagination you can actually contract and relax the muscle as much as possible, and you can then perceive that. Okay, third thing is the perception itself, like trying to feel the face same, right? So trying to close the eyes, observe the face, is there any difference that you're feeling? And then if you feel that there is some tension on one side of the face, trying to voluntarily bring your focus and relax the facial muscles as much as possible and keep on trying it again and again and again. That's what allows the synkinesis to come under control. Synkinesis management is a very long-term process. It can take years, sometimes 1 year, 2 years, 3 years, depending on the severity and how you respond to the treatment. Some initially, if identified soon and worked on it, are lucky enough to stop the development of synkinesis there. But if you're worrying a lot, if you are utilizing a lot of worry-based facial expression, if you're shouting, you're screaming, this kind of expression is going to worsen the symptoms, and that's why that needs to be avoided. Along with that, it's important to have a good sleep quality. It's important to have good mental practices like meditation. It's important to have a good physical schedule, physical activity schedule, so that your entire well-being quotient is maintained, because that is important to maintain your immune system so that you don't land into the next episode of Bell's palsy, because there are 8% chances of getting another episode of Bell's palsy. We just don't want to get there, right? So this was all about an recap or rewind of all information that I've shared in my previous video on Bell's palsy. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.